So my practice sees a range, well, the full range really of sporting injuries. At this time of year, a lot of pivoting sports and skiing season, so a lot of ACL ruptures, but also minor sprains and strains, so partial ligament tears or meniscal injuries. I guess I work very closely with a range of physiotherapists and sports doctors and referring doctors, so there's I guess a whole group of injuries that I see that they send in for further opinions as well. So some of the more complicated injuries, or perhaps things that started as a minor niggle and have never really gotten better. One of the key signs, I guess, is to think about how the accident actually occurred or how the pain first started. So if you were skiing and it was a high speed versus a simple little slip over in the car park, then that might raise your degree of suspicion that perhaps this is more likely to be a significant injury. Certainly soon after any injury, if there's a lot of swelling is one of the main signs of a significant knee injury. If there's something that's torn or bleeding within the knee, or if there's a loose fragment that's irritating the knee, usually that results in swelling. Other things, if it seems to be getting better at first, but then it never quite fully settles down, or if you're having, I guess, a recurrence of the same problem. So if every now and then things are okay, but something goes click or clunk, or if you have everything seems okay, but then you notice that there's some instability, so you can't quite trust the knee, that's often a good sign that it's worth seeking some further advice. One of the other things that I do see in my practice is that people who've had a really good sporting life, and as a consequence of that they've had some injuries a long time ago. So whether they had an ACL reconstruction or had a knee that was never quite right and they carried a bit of injury, and now they're 20 years down the track and they've got pain and swelling, and that really impacts people differently at different stages of life. So perhaps they're working a manual job and they're struggling to do their duties at work, or even sometimes something as simple as playing with the kids and teaching them to kick a footy. And there's a whole range of ways that can impact people, and I guess it's important to consider each person as an individual and look at their knee and assess it in terms of where the damage lies. And there's a range of solutions that you can apply as well. You have to consider all of the fundamentals and do them to a really good standard. So rehabilitation, simple pain relief medications, practical solutions and ways of adapting things in your day-to-day life. But when it goes beyond the simple things, then there's a range of knee preserving options, whether it's a realignment or an arthroscopic procedure, or something that for this group of people is often an option is a partial knee replacement, where you're resurfacing and addressing the part of the knee that's wearing out as a consequence of an old injury, and preserving otherwise normal tissue, and a partial knee replacement is often a good option for people in this group.